Hi, my name is Laura Guerra-Cardus. I'm with the Children's Defense Fund of Texas and appreciate the opportunity to testify today. As the committee develops its two-year budget with all its state's priorities, we know that the decisions made within healthcare are amongst our most important. How we choose to invest has enormous consequences, both in the health of our healthcare system and on our people. It's also, our healthcare programs, one of the main vehicles of bringing back our federal tax dollars. This committee has a unique opportunity to make decisions that will accomplish three goals. One, to bring even more federal dollars back to Texas, extending life-saving healthcare services to hundreds of thousands of Texans. Two, to stabilize a stressed hospital system. And three, to create a long-lasting ripple effect across the state, a positive economic effect. We're here to testify in support of closing the coverage gap. We see this as much of a healthcare issue as it is a budget issue. In 2013, HHSC and LBB did estimates on the cost of expanding coverage, and basically the highest biennium estimate from any of those groups was $1 billion. Just to put that into perspective, that represents 0.01 of the proposed Senate budget. So where would this money come from? Former Deputy State Comptroller Billy Hamilton estimated that we currently spend $1.2 billion on a patchwork of healthcare programs that serve the same population. So one option would be to put that $1.2 billion in expanding healthcare coverage, no longer requiring the patchwork of healthcare programs, and providing a healthcare option for 1 million Texans instead of a few hundred thousand individuals. The Perryman report, the Economist Group, also shows that every dollar spent at the state level brings even more dollars both at the local level and at the state level. So bottom line is that we have the money to pay for a coverage expansion. That's why businesses, the large majority of chambers out there and business entities support coverage expansion. They cite the job creation is one of the main reasons for that. I included a few attachments, one with the support for closing the coverage gap amongst local county judges, the business chamber, and then the second is a profile of who's in the coverage gap. Just a reminder that 76% of adults in the coverage gap are in working families, 100% of them are U.S. citizens. In closing, we really need the leadership of this committee to have a real understanding and deliberation on what this would mean for Texas, and we thank you for the opportunity to testify.